and it's organized with support from the World Economic Forum. And it basically brings together these experts talking about COVID-19 and how to minimize its impact in Africa.
And on people accessing such services. Other vital health services have been crowded out. I have two key messages for you today. One, to the governments and health authorities. I urge you to find ways to reintroduce other health services safely and quickly, once community transmission is under control. Two, to the people and communities, ensure your child is vaccinated. If you have concerns about accessing these services, there are ways to do so safely. So let's look more closely at immunization. Last week, we marked European Immunization Week. Immunization is one of the most effective health tools we have, protecting children from many diseases that would otherwise be debilitating or deadly. Now, as scientists work together across the globe to develop a safe, effective vaccine against COVID-19, we are once again reminded of how precious vaccines are. I am very happy to be joined by our chair of the European Technical Advisory Group of Experts, Professor Ade Finn, today on this panel. Since 2017, the European region has been experiencing a resurgence of measles. In 2018, over 500,000 children missed their first dose of measles vaccination. In 2019, over 100,000 people across all age groups were infected as a result of this and long-standing immunization gaps. Today, measles continues to spread in some parts of the region, affecting over 6,000 people in the first 2 months of this year. We cannot allow this situation to worsen. We should do everything within our powers to prevent children becoming victims of this pandemic due to their vulnerability of vaccine-preventable diseases such as measles, diphtheria, mumps, and rubella. COVID-19 cannot be permitted to claim this collateral damage. We are concerned that countries may have seen interruptions in routine immunization services, including among vulnerable groups, and the interruption of measles outbreak response activities. To governments and health authorities, I say this: immunization services are essential. If they have been interrupted, catch-up measures must be taken as quickly as possible. We cannot allow the impact of COVID-19 to be amplified by neglecting other vital health protection measures. I do appreciate that during COVID-19, countries have found new and innovative ways of reaching children, using temporary vaccination points. Health professionals delivering immunization programs across the region are working hard to ensure that as many children as possible have access to vaccine services while preventing COVID-19 infection. Some health services have introduced parallel tracks with regular checkups and vaccinations for babies, staggered to ensure limited indoor waiting times, and kept fully separate from curative care for others. These efforts are very welcome, and I also commend the determination of parents and caregivers to keep their children safe. I urge countries to continue prioritizing immunization, innovating services, communicating to parents, and meticulously tracking every single missed vaccination. Catch up as quickly as possible where needed. To parents, make no mistake, the safest choice also during this pandemic is to vaccinate your children. Use this opportunity to protect them and others from diseases that we can prevent. This leads me to my final message for all of us. COVID-19 is not going away anytime soon. Dual-track health systems can offer the flexibility and resilience needed to manage repeated waves of coronavirus infections and the increasing demand for other services. The new COVID-19 Health System Response Monitor, launched by the WHO Regional Office, the European Observatory on Health Systems and Policies, together with the European Commission, is collating evidence of how health systems are responding to the pandemic. Please use that valuable resource. We must be alert and open to new ways of delivering and receiving health care. We cannot risk seeing the tragedy of COVID-19 mirrored in a second catastrophe of ill health from other causes. In short, to authorities, maintain a dual-track health service. To the public, keep using immunization services where available. By doing so, we leave no one behind. Thank you.
Thank you very much, Regional Director. Right, now we're going to come to some of the questions that we've received in advance first, just a couple up front, and then I'll take those from the reporters that have joined us, the media that's joined us online. So the first question, I think, so we have Dorrit Nitsan, the Acting Regional Emergency Director for the European WHO European Regional Office on the line. We have Professor Adam Finn, and we have Siddhartha Datta joining us on this panel. So thank you all very much for joining us. So the first question, I think, is to you, Dorrit, if I may, from Ales Zapotoki from the Czech news agency CTK. And it reads, is there any recommendation for numbers of care unit beds or mechanical ventilators per 100,000 people? Alice has got a second question, but I'll come to that afterwards. Thank you, Dorrit.
Thank you very much. And indeed, WHO published at early stage the package of services and what is needed per country, per population. It's all published, and I will be ready to share with you after this the link. It is available with concrete numbers of tools, medicines, beds, vents, as other things that are needed to be in place, including surge capacity calculator for the healthcare workers. So all of it are included in a package. Thank you.
Okay, thank you, Dorrit. We have Alice also asking a question regarding masks. Is it really beneficial to wear face masks or other cloth face coverings on the streets? Is the general public wearing masks, like in the Czech Republic, safe during the summer months? I understand wearing a mask in public transportation or in grocery stores. I don't quite get the last piece of that, but I think you get the general gist of this. Dorrit, please. We don't hear you, I'm afraid, Dorrit.
Oh, is it okay? Yes, we continue to recommend that healthcare workers and those that are caring for the sick and those that are sick will use the masks. If there are enough masks in the public, it can be used. But we are warning that this would require the people, the population, to really understand that the masks are not standalone, that have to come with a full package of hygiene, of keeping distance from other people, and follow all the recommendations that are coming from the authorities. So the masks are not standalone, they are not helpful, as we know, but we say that if you do have enough, go ahead, use it in the full package of care. Over to you, Rob.
Okay, thank you very much. Thank you very much, Dorrit. Okay, we had a few questions regarding the missions to Turkmenistan and Tajikistan that the regional director announced last week. So the first of these is from Kirill Krivishev from Kommersant newspaper in Russia. And it reads, when the WHO missions are going to visit when are the WHO missions going to visit Tajikistan and Turkmenistan? Are there the detailed plans of these trips? Are the WHO experts going to verify the various media reports about suspicious cases of pneumonia deaths and strange burial ceremonies? I'll pass that over to you, if I may, Hans, and then maybe to Dorrit thereafter. Thank you.
So the missions to Tajikistan and also Turkmenistan fit into the work and the mandate that WHO is doing. We have long-standing relationship with both countries. In fact, as of today, about 60 country missions to assess with the national authorities have been conducted to assess situation and work with the national authorities. We got a green light from the Ministers of Foreign Affairs of Tajikistan and Turkmenistan to our missions to fly in, and I would like to express very sincere appreciation to the national authorities of the countries, but also to the United Nations sister agencies on the ground with who we are collaborating very closely. So the main aim is to work with the national authorities to strengthen the preparedness of the country, but not only for a COVID-19 outbreak, but in general as part of our work for any emergency in the future, and strengthen in that sense the national and subnational capacities.
Thanks very much. And Dorrit, would you like to compliment?
Thank you. The mission to Tajikistan, just to add to our regional director, the mission to Tajikistan is leaving tonight to try to go on a flight to Dushanbe. This is not going to be easy. There are border closures. There are demands to be checked and in either stop on the way. It's not easy at all. We have many challenges, and we will hopefully get there. So when we get there, we will work, as we heard from our regional directors, shoulder to shoulder with the authorities to prepare and respond if needed. Thank you.
Okay, thank you very much, Hans. Thanks, Dorrit. I have a related question here, and I think it's back to the two of you, from Joanna Lilis, who is a reporter with The Economist based in Kazakhstan. And the question reads: in media interviews, the WHO mission head in Tajikistan has endorsed the coronavirus testing system, has endorsed the coronavirus testing system in Tajikistan as corresponding to the requirements of international standards. On what does the WHO base its assessment of testing systems in Tajikistan and also Turkmenistan? Does WHO have some...
All right, some important information coming out there. Some experts giving us some important information with regards to COVID-19, saying that COVID-19 is not going away anywhere anytime soon, and we must be alert with regards to this disease. We're going to leave that briefing for now. I want to get